Looking for a quick overview of inpatient orthopedics? This is the video for you. Hello everyone, and welcome back to another installment of our Clinical Survival Guide series, this time in inpatient orthopedics, following our outpatient orthopedics one that we did within this past week. So now you have both sides of the coin, both in the inpatient and outpatient setting. But today, just as I did with the outpatient orthopedics video, I'm going to give you guys just an overview of what the role is within inpatient orthopedics, the people that you may work with, types of patients that you may see, conditions I saw the most, how to prepare for the experience in general, as well as some useful resources I created for myself throughout my experience. Again, similar to my other video, I'm going to kind of gloss over the first two aspects of this video just because I've touched on them a lot more within my inpatient in general clinical survival guide, so you should make sure to check out that video if you want more detail on those sections. But let's get right into it with our role. Within the inpatient orthopedic setting, our main roles are really to help with discharge planning, to help meet mobility requirements for activities of daily living and independence within that discharge location, do a bit of movement analysis, help with flexibility and strength, as well as assistive device use for their discharge location, including gait training with those devices and so on. Within the inpatient orthopedic setting, you're going to be working with numerous professionals throughout the healthcare spectrum in your experience here. First of all, starting with the medical doctors, the physician assistants, and the nurse practitioners. You're also going to be working with case managers. You're going to be working with charge nurses, step nurses, resident nurses, and certified nursing assistants, as well as occupational therapists and potentially mobility techs. Of course, on top of all of these other professionals that I just mentioned, you will be seeing speech and language pathologists, but it's just not as common to work directly with them on the orthopedic floor. And depending on the location you're at, they might have physical therapy assistants or physical therapy aides, but at least in my experience, that wasn't as common in this setting. Now, as for the people that you may run into as patients within this setting, there's a decent list, but it can be pretty much narrowed down to post-operative patients. This could include those who underwent total hip arthroplasty, total knee arthroplasty, open reduction internal fixation, spinal surgeries, amputations, and total shoulder arthroplasties, although less common, as well as instances of trauma, as well as generalized deconditioning. Now, of all of these possibilities that you may have, especially within the post-operative realm, the ones that I tended to see the most were total hip arthroplasties, total knee arthroplasties, spinal fusions or laminectomies, as well as open reduction internal fixations. When preparing for an experience in inpatient orthopedics, I would think about a few things to give yourself a head start before you head into that experience. The first of which is going to be making sure you're familiar with the weight-bearing precautions as well as their associated gait patterns. I would also make sure that you review all of your post-operative precautions. I'm going to put on screen right now the post-operative precautions that I can think of off the top of my head that were really important for me to remember, which were spinal precautions, including not bending, lifting more than 10 pounds, or twisting. The way that I really liked to help patients learn this was telling them BLT like the sandwich, no bending, lifting, and twisting, and it tended to stick pretty well, so you can use that if you would like as well. On top of the spinal precautions, you're going to want to review your posterior approach total hip arthroplasty precautions, which typically are no hip flexion greater than 90 degrees, no hip adduction, and no hip internal rotation. As for the anterior approach, it's no hip extension, no hip adduction, and no hip external rotation. Also, I know that one of the random things that I ran into that is especially common within those spinal cord type procedures is dural tears that A lot of the time it has to do with a procedure changing the elevation of the head of the bed, so make sure that you check in with your clinical instructor on what the hospital's procedure is that you're working at so that you can be familiar with it. On top of this, you also want to be familiar with amputation precautions, which typically include non-weight bearing through the affected extremity until the wound is healed and swelling is controlled, as well as making sure that they have a splint or a sleeve worn to protect the limb and help them minimize their swelling. Now, the precautions that I just went over are at least ones that I have seen through my experience with the surgeons that I have worked with. It may be different at your hospital, so make sure to check in on those things, but hopefully it gives you a quick overview of what might potentially be some of those precautions. Now, going into the setting, you're also going to want to be familiar with how to don and doff different braces. The first of which is going to be a cervical collar. That way you can be prepared if anyone has a cervical spine surgery. Also, you want to know and be familiar with the TLSO, also the LSO, and the abduction brace. Just as I went over in my outpatient orthopedics video, outcome measures can be very important and can be quick and easy ways to track patient progress over time, so I've created a list of them right here. So this quick list just goes over a few that are relatively fast to do and are feasible to do within that inpatient setting. The first of which is going to be a 5-time sit to stand. You have the 30-second sit to stand, a tug, cognitive tug, timed up and down the stairs, supine to stand test, modified CTSIB, the 10-meter walk test, as well as the 6-meter walk test. Now, on top of these outcome measures, some really great patient-reported outcome measures that you can use, as I emphasized in my outpatient orthopedics video as well, are going to be the numeric pain rating scale, as well as the patient-specific functional scale, which really helps you be very direct towards your patient and can be used in whatever setting you're in, so they're always good ones to be familiar with ahead of time. Especially for me, since my first long-term rotation and first time in clinic on my own was in this inpatient orthopedic setting, that I made sure to have a kind of cheat sheet for myself that I'm showing on screen right now. This gives an idea of what questions I asked during the subjective interview to make sure that I had a good picture of what the patient's discharge location could look like to best inform where I would recommend them for discharge. On top of this, I had things such as documentation information to make sure to update certain pieces within our documentation software, make sure that I was educating the patients on everything that they needed to before I ended each session, made sure that I was thinking about all the different pieces of gait to really best document that so that the entire healthcare team during rounds could understand the patient's mobility each day. On top of this, I had the timing for Medicare just to make sure I was doing it properly with units as I was still learning those, as well as put in some additional information such as some abbreviations that I ran into that I was just having difficulty remembering since I hadn't encountered them much in the didactic work yet, as well as things that were important for me to look at in chart review, and the people that I needed to make sure to send messages to when I was preparing a patient for discharge. And with that, that's the end of our inpatient orthopedics clinical survival guide. I hope you were able to find something within here that will help you prepare for your clinical experience coming up and give you a good outline of what you might be able to expect. If you enjoyed this video and want to check out my other clinical survival guides, such as the inpatient and general clinical survival guide, make sure to check out my channel as a whole for other videos including day in the life content, other clinical survival guides, some stereotype videos just for fun, as well as some various other content such as MPTE prep that will be coming up soon. If you enjoyed, make sure to hit that like button and subscribe down below, as well as check out my 20% off code for Picmonic if you are looking to start preparing for the MPTE yourself. Thank you all so much for watching. This has been KBDPT, and I'll see you all in the next video.